press down the space bar on your... Hello? Yeah, press down the space bar on your thing and say something. Hello?
Sharon, hear you. We hear you, Sharon. Seeing you as well.
Are you hearing me? I don't know what's going on.
Hearing everybody, we're about to go live, so I'm hearing everybody. I'll put on your microphones when, so.
How do we indicate again when you want to speak? Oh, Lord.
I will let you know. I will let you know.
Okay. All right.
Okay, let's begin. Good afternoon, everyone. My name is Michael McGarrell, and I work at the Amerindian People's Association as a staff. Today, we want to provide an update on the work we have been doing in relation to COVID. You may be aware that the APA has been doing work around the country in several regions, and today we want to spend some time providing an update. I know you would have seen some of what we were doing, but we want to tell you a little bit more in terms of what exactly we have done, where we have done it, who are involved, and things like that. But we also want to provide an opportunity for members of the press to ask questions. And we have with us today our staff who have worked in the various regions, as well as our executive director who will present to us an update, a general update. And then we have various staff members who would have been coordinating activities in the different regions. They too can provide an update in terms of what they would have done in the specific region. So we would like to start today by having our executive director, Ms. Jean LaRose, to tell us a bit about what the APA has been doing in terms of the COVID response in Guyana over the last several weeks. So I'll hand you over to Ms. LaRose. Jean?
Hearing Jean.
Okay,
Community. Sorry?
Go ahead, Jean.
Yes, I was saying today I'd like to just provide some basic information in relation to the work that the APA has been doing in relation to the COVID-19 pandemic that has affected all, I would say all of the indigenous communities throughout Guyana. We, as you may be aware, unlike Region 4 and those regions close to Region 4, the indigenous communities were and are the last to be hit by COVID. And I'm saying the last, hoping that we don't have a return or that it doesn't happen in the same way, to be hit by the COVID pandemic. And the Santa Rosa village in Region 1 was most hard hit in terms of the numbers of person being infected. Fortunately, the death rate has remained very low in terms of it being only one person. So to date, the APA has reached out to Regions 1. In Region 1, we collaborated with the village councils of 11 villages within the subregion. Not only Santa Rosa, but we did a lot of work in Santa Rosa, but we also collaborated with the village councils and other resource persons for 11 villages within the Moruca subregion. For those 11 villages, except for Santa Rosa, but for the other villages, we provided PPEs like gowns in some cases, disposable gowns, masks, both sewn and disposable. We provided gloves. We were able to provide some infrared thermometers and also sanitization and cleaning liquids like bleach, alcohol sanitizers, and we were able to also provide some blood pressure kits and some oximeters as well for some of those outlying communities. For all of the 11 communities in Region 1, we provided food supplies, and the varying numbers, we were able to impact a huge number of households within those communities. As in Region 2, 6, 7, 8, and 9, where we also reach out, we provided some of the basic food supplies such as rice, sugar, flour, salt, peas and beans, cooking oil, onion, things like that, to households. And in some cases where we were aware that households were large, we provided extra amounts in some cases. That's the case for Region 1. In Region 1, we also provided some amount of support to the fishermen by giving them seines and hooks and giving them salt so that they do not raise the price of their commodities. In the Moruca subregion, it's a riverine set of communities, and we rely heavily on fish from the rivers and fish from the sea.
Charlotte Street between comments. I'm actually in again. Bring it and drop it downstairs.
It's part of our diet. In Region 2, we impacted 5 out of 9 villages. And there we also supplied some basic PPE. We also provided some food supplies. And I think we also gave some seeds. Here we also, the PPE largely went to the health centers in those areas who basically had little or none of those supplies. In Region 6, we impacted, Region 6 has joined Oriala Siparuta community. It's the largest community in the sub-region, and we were able to impact 75 households with food hampers, but we also provided things like fuel that could run the generator to power the generator that support the health center and some other building. I cannot remember that. But we also provided some basic PPE as well. Then in Region 7, we impacted 8 out of the 9 villages, I think it is in the Upper Mazaruni. And there we largely targeted the pensioners, but we also, for the food supplies, but we also targeted the health centers for PPE, sanitization products, gloves, and some basic equipment as well, similar to what we provided in Region 1. In Region 8, we impacted 9 out of the 18 villages in the North Pacaraimos area. And there again, we provided food supplies and some PPE and over-the-counter medications in some cases, and also multivitamins, which we also provided in the region 1, 2, and 6 areas as well. In region 9, we reached out to 24 villages. We supplied over 1,000 food hampers, and we also provided some amount of disposable masks and so forth, similar to the other regions. In region 8, we were able to supply masks for the school children writing the CSEC exams, and in region 9, we were able to do that. We may have done some of that for region 1 as well. So those would be some of the communities we reach. Just to summarize, region 1, 2, 6, 7, 8, and 9, and we would have impacted over a few hundred households by supplying hampers and by supplying other commodities to other persons like farmers and fishermen in those communities, as well as to the health centers. We did some awareness work within the communities. Unfortunately, we were not able to get our posters out in time when we were sharing the food and other supplies. But nonetheless, those went in later and are still going into the communities. The APA produced 5 of its own posters targeting those communities, targeting like how to wear your mask properly, how to hand wash properly, what is COVID, and so forth. We were able to do a number of videos as well. One in particular stand out with a little young man explaining what he know COVID to be and encouraging people to stay at home and engage in the necessary practices to prevent the spread of the COVID virus. We also impacted where we tried to share these very videos and other information materials on Facebook. Primarily Facebook, because that is what is most of the communities who have some amount of access, limited access to the internet, would readily tune into and get their information from. So we largely use Facebook to share some information, whether it's the awareness posters and other things. To date, we have spent over 29.5 million Guyana dollars, and this would have come from monies that we sought permission to repurpose out of our own project funds from various project partners that we're working with, or monies that were raised specifically for the COVID relief efforts. So some of those who have supported these efforts include the 10-year facility, which is a current project partner, Neotero, which is also a current project partner, Neotero, who operates out of Sweden, the 10-year, out of Seattle, and the 10-year facility out of Sweden, Rainforest Foundation US that operates out of New York, the Amazon Emergency Fund, which was a fund put together very hurriedly as COVID started impacting Indigenous communities, and various Indigenous communities within the Amazon region are currently benefiting from that. The Koika Ford Foundation also made a contribution, and the private sector also made a contribution in terms of food supplies. We have other persons who are interested in also supporting, whether it's in food or others. And therefore we have some amount of food, which we, as soon as we start our second set of distribution that we've received from Rhonda Lam, the Citizens Initiative. We also receive food from the private sector commission that has gone out already. Vanda Radzik, I know she is very, she didn't want this information to be out there, but I think it sets a very good example as someone donating also to the effort, and she made a very, very sizable contribution to the effort in Region 9. And then we, just this morning, we received also another sum from the FLEC Facilitation Unit. But outside of that, we will receive more funds from the Amazon Emergency Fund. We have an SOS effort that was launched by the Rainforest Foundation recently, and we have received funding from them. And we're also out of other project funds. We will be able to dedicate more funding towards some of the other communities. And therefore, our plan is to reach out to Region 1, where we have not, the other sub-region that we have not reached out to, primarily the Mabubu sub-region. Region 9, the South Pacaraimos. Region 7, the Upper Cuyuni, the Middle Mazaruni. And then we will also try to go back to parts in Region 8 that we've not touched, and parts in the Upper Mazaruni that we've not touched as well. So those are some of the areas that we have covered, and the support that we have received from the various donors and individuals as well. And we're very grateful for all the support. Our effort was led by our in-house staff. So for Region 1, we had Sharon Atkinson, who coordinated for the Maruka sub-region. She also coordinated for Region 2, and she also coordinated for Region 6. Don still assisted her in Region 6 and the other communities as well. In Region 7, Laura George coordinated for that region. Region 8, Michael McGarrell, and in Region 9, Ron James coordinated. And I think they really spent a lot of time on getting out there, getting the supplies, getting concessions. So we had from Region 1, we had in the Maruka sub-region, business people like Boyo Ferreira and the Costas, who subsidized transportation costs or gave transportation costs entirely free to deliver supplies to the communities. And I know in the case of Region 7, there were some reduction in the freight costs to get supplies to some of those communities. And you had similar efforts in other regions as well. So we're very thankful for all the support that we have received so far. Michael.
Thank you, Jean, for providing that brief update on some of the work that we would have done in the regions. And I know it has been quite a lot of work that we were involved in, and you would have spoken a little bit about the funds and where we would have gotten those funding from, both international donors as well as local private citizens who would have contributed to our efforts. And we truly appreciate that. So what I'm going to do now is just ask for each of the coordinators for the various regions to talk briefly about the work that we would have done in their specific region. And I'll just go randomly, and I'll start with Laura George, since she is on video already. And I'm just gonna ask that when you are about to speak, if you can put on your videos so that we can see who it is that is speaking. So Laura, briefly, if you can tell us a little bit more about the work in Region 7 and what would have happened.
Okay, thank you. Thank you, Michael. So to add, Jean has already pointed out the numbers and all of that. What we try to do is to get from the villages through the leaders and the Upper Marginal District Council body on priorities. And we did receive some priority areas for supplies and support, but we further had to break it down to accommodate our amount of spending, or rather allocation for the Region 7. But this for the Upper Mazaruni. What I would say, because Jean has already said a large part of that, what I will say is that wherever I went in Georgetown, trying to get supplies purchased or to get it sent up to the Upper Maz, in explaining to the business persons what we were doing and why I was doing this, it was for the organization and our support to combat, the COVID pandemic, and to support villages and to prepare them for what may come. I found that a lot of business persons including the airline services that we would use, because that's the only way we can get these things up to the Upper Mars villages. It was 8 villages in all. I think they quickly came on board and offered a discount on the charges for freight, for cargo, because it's very costly trying to get them up to the villages. But I think I was so proud to know that in Guyana here, we were coming together to do this for each other, you know, and I think that I was really very proud of that. So I would like to say thank you to that again. But we have been coordinating with the villages, and we very basic, you know, it was just very basic touching of the support that the APA can give. So like, for example, to the households, and all households in the Upper Mazaruni, using numbers that we've gotten from the National Tushaus Council, we were able to send them their sanitization supplies, like the soaps, soap powder, and the blue soaps that they needed. That's for all households in the Upper Maz. We've supported all health centers in the Upper Mazaruni as well. And as Jean pointed out, to the pensioners in the Upper Maz. And so we're also looking forward to see what other support we can get as an organization, and to send that forward up to the communities. And it has taken time in Georgetown, you know, but I think with a lot of help from my family members who were able to help me sort out and fetch and all of that, I think we were able to get it up to the communities. And so that has been our experience out here. Yeah, thank you.
Thank you, Laura. And Laura would have worked in Region 7 in the Upper Mazaruni primarily. Now we'll hear a little bit from Jean Sharon Atkinson, who would have worked in Regions 1 and 2. Jean, Sharon, and please put on your video, Sharon. Sharon? Okay, so while we wait on Sharon, we can probably ask Don Stull to provide an update on Region 6. Don would have worked in Region 6, so if she can just provide a brief update for us. Don, can you please put on your microphone?
All right, it's on. So for good afternoon. For Region 6, we would have provided 75 hampers for Oriella Sabruta village, which 50 went to the main village, which is Oriella, and 25 for Siparuta village. For the food hampers, is like basic, and we provided rice, flour, sugar, and some other like detergents. To get the items to the village was not so much of a hassle, because we had the commitment and the help from the village council that we work closely with, and the feedback we got from the village as well too. The villagers were overwhelmed, and they received and thanked the EPA for their support. That's basic for me.
Thank you, Don. So now we'll have Jean Sharon Atkinson to provide a brief update on Regions 1 and 2.
We have to mention medical supplies.
Sharon, can you please unmute your microphone? Thank you. Sharon, could you please unmute your microphone? Thank you.
Oh,
Go ahead.
for the Maruka sub-region, we supplied basic food items for 1,130 households, impacting 11 of the 12 communities in the Maruka sub-region. We also targeted the health outposts with basic PPE and over-the-counter medication, Panadol especially, and vitamin C tablets. We also assisted those riverine communities with seine, hooks, and salt for the fishermen in an effort to keep the fish cost and the supplies intact, or at least some amount of food security. Recently, we've also sent in vegetable seeds to the Santa Rosa village. We also donated a small supply of limes, pineapples to the COVID kitchen in Santa Rosa village. We are also thankful for the response from the local business community which we dealt with. Ferreira, he transported free of cost food supplies to 3 communities, and it cost us for giving us a discount on transportation to 3 additional communities as well. This effort came about due to the serious or the impact we knew eventually, and which did reach the communities. At least 3 communities in the Maruka sub-region were directly infected with the COVID-19 virus, and Santa Rosa was the hottest, the major community that was impacted very much. As a result of that, the business community were in curfew and partial lockdown. People were also mentally affected by staying at home and not being able to go out and do their normal work. So thus the need for the food supply and the communication aspect of that the organization eventually took upon, and Graham would eventually say more on that. We also reached out to Region 2, 6 of the 9 communities. We were able to supply 658 households. The community in the Pomeroon, the St. Monica, was also impacted by a flood during this time, not only the COVID-19 situation. And so the response from the communities, it was, for us, it was very, we felt that we did make an impact, and the communities were pleased to know that the organization was there when they needed that assistance very much. We were also able to target the health outposts, and with basic things like masks, gloves, vitamin C, Panadol, temperature guns, thermometers, and over-the-counter medication like chloroform and other basic drugs that the health centers needed. We worked in collaboration too with where we could have found an agri-extension officer, with the district councils, with the village councils. All of this contributed towards us being able to reach out, because we had to find out, do our own basic and quick research to meet the needs of the community. So it's not us just giving the communities what we think they need, but what they said to us that would have been the most necessary things, or what were their priority needs. Thank you.
Thank you, Sharon, for providing an update on the situation in Region 1. We'll now ask Ron James to tell us a little bit of the work that would have happened in Region 9. Ron?
Hi, like my video is not on, it's not coming on. Okay. Hi, good afternoon. Thanks everyone for providing an update. For Region 9, we work predominantly in South, Central, and Deep South, providing assistance for 21 communities in these areas. We also assisted 3 communities in Central, which is Parashara, Napi, and Hayawa. Again, we provided them with basic foodstuff, rice, flour, sugar, oil, onions, some soap for washing. For the village councils, we also gave cloth for sewing masks. We also gave them some sanitizing material to share between the village council office and the health centers. We also provided some masks and sanitizing equipment for the secondary schools, both in Aishalton and Sand Creek, for those students writing CXC. The villages and the village councils were very, very helpful in providing logistics, because it was personally a nightmare to try and divide everything up for the 24 communities that we were targeting. And to compound that, the rainy season had a real hard impact on the Rupununi and the areas that we had to get assistance into, and actually prolonged the amount of time that we had to spend there doing that. But the communities were very, very happy for this assistance, and I think that they felt that they're not being neglected. And I would really like to thank the donor agencies, especially from our partners, for actually releasing these funds to be able to assist them. And this, we were just able to do this just before the COVID-19 cases started popping up in some of these communities. And presently it is a challenge. It is a challenge for us to deal with some of these. The communities are struggling. Our health personnel is very limited, or the resources in the communities are in the region is very limited. And this is something that is impacting, I think, on the communities. And some of them are very fearful, while some of them are, it's something new for them. And I think some of the villages are underprepared for this pandemic. So I would really like to appeal to the health authorities and the authorities within, within the powers and the government, to actually see if more assistance can be gotten to them in a timely manner. I mean, we just noted that out of 47 cases that were tested last Friday, we only got results for 13, which we had 4 new cases for Sunday. So that is something that we really need to speed up the testing and all of these other things. So thanks, Mike.
Thank you, Ron, for providing that update. And in Region 8, I coordinated the activities down in Region 8, and we would have been able to provide food relief supplies to 8 communities, and medical supplies to 9 communities. We have purchased and have ready to send out thermometers for all the health centers in the North Pacaraimans, as well as over-the-counter medication. The villages that we have provided supplies to would be Monkey Mountain, Paramakatawa, Keto, Kurukubaru, Itabak, Kanapan, Kopinang, and Chinapau. And soon we're looking to provide more supplies to the other communities which we have not touched as yet. We have a concern as well in that we don't believe that enough and adequate testing is being done for our residents. And like I would have pointed out in earlier live streams, that the municipality of Urimatang has over 700 cases of positive COVID persons. And Urimatang is just over the Ireng River from the villages of Itabak and Kanapang. And it's a concern that persons on our side of the border can become infected as well. And because of this, we have been pushing and we have been calling for more testing and more timely testing, because it has been several weeks since the first cases were picked up in Itabak, and so far there has not been follow-up testing. And well, I learned today that that testing, a team should be going on Wednesday of this week. But we'd like to call on those who are responsible for ensuring that, you know, testing is done in a timely and adequate manner. And I'm sure that the village councils and persons in Region 8 are ready to collaborate and ready to work with the health authorities in ensuring that the testing gets done at the soonest opportunity. In addition to food and medical supplies, what we would have done as well is provide some awareness material in the form of posters, in the form of handouts, leaflets that people can read more about the COVID-19 virus. We were able to provide communities with loud hailers that they can, you know, broadcast messages in the villages. And this would have happened not just in Region 8 as well, but in other places. Not just that, but in the village of Paramakatoi, we were able to provide mattresses and linen and pillows for the quarantine facility that, you know, they are setting up. And we acknowledge and we respect that, you know, the village has seen it necessary to create a facility, even though they have not found any cases in Paramakatoi. They are preparing themselves in the event that, you know, some may become infected. And in that regard, they are setting up a quarantine facility. So as the APA, we were able to provide mattresses and other things for them. And we're ready to continue to collaborate with them in terms of, you know, helping them be prepared for any possible outbreak of the virus in Region 8. I'll now ask Mr. Graham Atkinson, Paul Graham Atkinson, to talk a little bit more about the awareness that he would have been doing in Region 1 in the village of Santa Rosa. Graham?
Thank you, Michael. Good day, everyone. So let's talk a little bit about what APA's general communication strategy would have been. Obviously, we would have been in contact with the National COVID-19 Task Force via an official letter. And you just mentioned the upping the ante for testing, Michael. That's one of the things that we had requested of the task force, was to not only up the ante in terms of testing in the Santa Rosa community, but also for all the other hotspots as they were around the country. We were also closely looking at what was happening across the border in Brazil. And so that meant, of course, that the communities of regions 8 and 9 bordering Brazil would also have been on our radar. So the APA in Santa Rosa eventually became the hotspot for COVID-19 in the hinterland. And what was done is that the APA took a decision, and I really thank management of the APA for allowing me the opportunity, once I got the chance to get into the community, to be on the ground, to shore up support for the village council, to shore up support for the regional health officials, as they themselves were grappling with the number of cases that turned out to be positive. And obviously, once those persons would have been in isolation, it meant that the efforts of the health team there would have been to provide care and support and treatment to those persons so that they can recover in a short period of time. So, being of the village myself in Santa Rosa, I'm a resident of Santa Rosa, and having worked before, obviously with APA, attending public meetings and knowing a great many of the people in the community, it made it easier for me to be able to help to launch an aggressive public awareness campaign. The APA, through our funders, of course, provided loud hailers. We had 3 going into the community. The idea was to have three teams with the same messages that we developed here in Georgetown, of course, with advice and support from our senior staff members, of course, with information based on what was happening with at the World Health Organization and PAHO and the Ministry of Public Health. So those information were basically blasted out into the communities from two teams. We took it from both ends of the Comacri-Cubana Road, and in a matter of a week, we were able to cover all the satellite communities, all the little byways where people are living, and generally those are the ones that do not have the information, and we were able to have them understand what COVID is and what they need to do to protect themselves. And I thought that the APA's youth-led media folks, two interns in Santa Rosa, Mishak Atkinson and Kieran LaRose, were also part of this. And so I think we were able to put our heads together and have debriefs almost every day about what we were doing. And we were able to cut through the narrative, I would say the false narrative that was going on in the village. So what did I find when I got there was that the situation was one of trepidation, of fear, of the unknown. Obviously, those are things that will pop up when you have a pandemic or something new. There was a lot of misinformation as well being peddled by I would say unscrupulous persons, and there were also some non-cooperative residents, especially those that operate the speedboats and so on, not understanding that when people move and passengers on the boat are close together and so on, these are the situations that give rise to the further spread of the virus. And so there was also a big lack of the understanding of what the national orders and the special measures were saying and how that will impact life in the community. And so these are the things that as an organization, as a rep for the APA, I was able to help inform the village council, some of the council members, the Tushao, as well as the police, because I found that the police sometimes were not totally aware of what the orders were saying and what they need to enforce or not. And so I was able to do that along with, of course, supporting the RHO and team. He was very much on the ground and very open and appreciative of the efforts of our organization in ensuring that the right and correct information, the people will have that, so that when they will be able to have behavior change. And so what we have seen so far, the efforts are bearing fruit. There's been a containment of the virus in the village over the last 3 weeks. I was able to ask the RHO yesterday, and there's only been one new infection. And so that's pretty outstanding in terms of the efforts bearing fruit. And so it took a great deal of hours in the field, a great deal of sweat, I would say. But thanks to our donors who made it possible for us to be on the ground. And I must say that the residents and the village council and the RHO and so on, they cannot thank the APA enough for lending that support during a critical time, because of course they had no PR or public awareness approach at the time. I mean, they were too caught up in caring for patients, especially at the health level. All their officers, including the reporters, were basically looking to be part of the care for the patients in isolation. So that's a little bit of what I experienced. And Michael, back to you. Michael, we need to unmute your mic.
Sorry, thank you, I was distracted. Thank you, Graham, for providing that brief update on the awareness that would have happened in Region 1. Now we'll give an opportunity for anyone of the press, from the press, who would like to ask a question. If you'd like to clarify something, this is the time to ask your questions, and you can direct it to any of us or who would have spoken. So this is your time. So is there anybody from the press who would like to ask a question. Just turn on your microphone and you can put on your video as well if you wish and ask. Go ahead, Narendra.
Good afternoon, everyone. I'm Narendra from the Guyana Chronicle. On a general level, can you say what are some of the direct implications, direct and indirect implications of COVID-19 on hinterland and indigenous communities? I know you highlighted a few, but if you could put it into a synopsis for me, any one of the panelists.
Okay, I'll ask Jean LaRose to respond to that, and she may also wish to add a little bit more. So Jean, go ahead.
Hi. Are you hearing me?
Yes, can you put on your video as well, Jean? Thank you.
Okay, so the direct impact. There are many impacts, and I don't think we've exactly arrived at a position to know the full impact on the indigenous communities. Immediately, the impact would be on health, of course, because it's a virus, a pandemic we're dealing with. So immediately, the impact would be on health and the ability or the capacity of the various communities throughout Guyana's hinterland to deal with the health issues confronting them. We have seen the case of where I would say all of these communities have been unprepared to face a situation like this. Many of them had no PPE to start with, sanitization supplies they did not have. Basic over-the-counter medication ran out very quickly in some cases, or in some cases they didn't have any to start with. The long-term effect, we've read so much about it, but if you take into account the basic primary health situation or the level of our health among our people, and depending on how people may have suffered, my guess would be that they can be long-term, especially respiratory effects on the communities. Those could be something, and that's something that have to be dealt with. We can talk about the economies of the communities. Many people had to step down on their farming, had to reduce farming. For all indigenous communities throughout Guyana, cassava is a staple, whether it's farine, whether it's cassava bread, whether it's to make casserip or whatever, in whatever form we use it. It's a staple for indigenous communities, and it's also a money-making enterprise in some cases, where if you take Santa Rosa village, for example, where I'm from, on Saturday mornings, people would go with their casserip, people would go with their sauce, their karakura that you cook with fish and any other thing that you want to put in. People would sell their fish and whatever, and all these activities were hindered to some extent. And not only for Santa Rosa, but for other communities, because people could not go out of their homesteads, their living area for extended periods of time. So the economies definitely will suffer. And that, again, is an area that needs a lot of attention in terms of shoring up and improving on the agricultural system for indigenous communities. Of course, working along with the communities on what they have traditionally done, and let's see how we complement that to improve on their farming and other systems. Storage of food supplies is something that needs to be explored. How do we store farine for the long term? How do we store cassava bread for the long term? How do we store casserip and so forth for the long term? But definitely the economies have been impacted. People who are normally engaged in like carpentry and out of the income gained from that feed their families could not be engaged in those activities anymore. And I'm very much aware of this because I have family members who would have been impacted in that way. In terms of education, wow, that immediately had a serious impact on indigenous communities. Of course, all schools throughout Guyana had to be closed, and the schools in indigenous communities were not spared. The downside of the closing of the schools and the disadvantage in some cases of hinterland communities is that they don't have ready access to internet, or if they do have internet, it's very expensive and may not be of the best quality as well. And therefore, any learning carried out by any online platform means these communities would have suffered from the, in many ways. Even if they are delivery of hard copy documents like printed test papers and printed study papers and printed work papers and so forth, the outreach in those areas was not the best. I'm aware of children having to write the 6th grade examination, not being much prepared, as much as it was said that papers were sent out and so. Some people did not even know when the exams were going to be written. And likewise for CSEC, they would have been impacted in the same way as well, not having benefit. You know, people say that by the time school closed, that you know, the syllabus would have been covered or should have been covered. That's for me, that's a lame excuse, because you're off. Many of them, in fact, did not cover the syllabuses, and you're off from a learning environment. You have parents who may have not completed secondary school, may have not completed primary school, may have not gone to school at all, may not be able to read and write. How can they work with their children if they themselves don't know how to do that, right? Then you had children who returned, children and adults who would have returned home back from schooling on the coast here, whether it's the Essequibo Coast or Berbice, or the majority would have been in Georgetown Region 4 area. They returned back home. This impacted university students as well. How do the students catch up back? What systems are going to be put in place to ensure that the students catch up back on where they left off, and those who were just entering into the school system, how they catch up? So those are just 3 of the areas that I can pinpoint immediately that I know there'd be serious impacts.
Thank you. A follow-up question, if I may. You spoke about the economies in the community and income earning. I know mining is a viable source of income in indigenous communities. And we've seen calls for this to be removed from the list of essential services. Can you say if the APA shares the same view?
Yes, the APA in fact had written to the task force very early and have made public statements in relation to mining being deemed to be an essential activity. Why is this so? If we look at what's going on in southern Guyana at the moment, where mining is taking place in the Marudi Mountains in the deep south areas, and where a community has little or no control, and where there is official sanction of the activity, including passage of people through the community, the chances of an infected person or infected person passing through those communities and leaving the virus could be very strong. Let's take Chinese landing in Region 1, in the Maruca subregion. Mining has been taking place uncontrolled, unmonitored, and therefore the miners are free to do whatever they were. Now you have the Chinese landing village that is close to the mining areas. They do not have medication. They do not have PPE. They have a basic health outpost, if any at all. Miners are not necessarily people from the village themselves. Those could have all have serious impacts on the communities. So while some communities are engaged in mining, yes, if you take the overall picture and you take the overall impact on the communities, and we're now seeing an outbreak. We saw Santa Rosa, and we saw how Santa Rosa dealt with it. I'm from Santa Rosa as well, so I have a fairly good insight of that. We saw how that was dealt with. But you have now cases popping up in all the other regions, Region 8 and so forth. How will those be dealt with? We started off by saying that we felt in all areas, whether it's control of mining and monitoring, whether it's the health system in all areas, the strategy was not, there was not a strategy or a very undeveloped strategy. And that continues to be the situation.
Thank you.
Thank you, Jean. There's a question here from Isanella Patois. It says, she's from Newsroom. Of the 18 COVID-19 cases recorded at the weekend, how many are from Indigenous communities? I'm not sure if anyone is able to answer this question. Is there anyone who would be able to answer that?
If I may, Region 1 has had no new case of those numbers that were released. I was told that they are from Region 7 and 9.
There was 4 for Region 9, 4 for Region 9, 3 for Patarnao and 1 for Quaico. 4 new cases over the weekend. And again, as I said, they had 47 tests that were done, but we only got results for 13. And out of those 13, there were 4 confirmed.
Thank you, Ron. Is there any other question from any of the news agencies?
Just one more from me. How have persons responded to the control measures? Has there been compliance, or persons have been going against them, for the want of a better term?
Maybe I can ask Laura or Graham to answer this. Please put on your microphone, Laura.
Okay, so how have persons responded? It would be challenging to give a black and white answer to that question. Nevertheless, it's something that we need to respond to, and because especially we also need our Indigenous communities to understand that yes, we've had responses varying from different families. Jean spoke earlier to how it has impacted economies in villages. Livelihoods have been impacted by the lockdowns and everything else. So people, number one, in the communities are not free to reach out to help each other the way we've done it all through the years, in helping to cut farms or helping to plant farms. That has been on a hold because of that. With the lockdown measures and the laying off of workers, it has been a challenge to families, for parents to provide for their homes. And so to that end, we would have seen some persons or some families who appear to be not receptive, but it really is a measure of the need to be out, to be able to be out to provide for their families. On the other hand, we've also seen some persons coming out on social media to say that that coronavirus is not real. And it has come from either not knowing information, not having access to independent information, but we're also aware that it has come as well from a political induced source, and that hasn't helped communities. And it has been unfair to communities as well, because where villages or families do not have access to independent information, feeding them or thriving on their lack of information is absolutely wrong to the families and to Indigenous peoples. Where families have been receptive of saying, yes, we understand, this is the situation, we need to take or respond or follow measures, it has still been a challenge in terms of how do we supply or how do we provide for our families? So we are aware that there have been various groups who have tried to reach out, have their drives of support to families. In the hinterland, it would have been a lot more challenging because we understand that there has been no, I think there has been no governmental subsidy or support to the hinterland communities. So if the APA or the NTC or other organizations that have been reaching out to supply families, I think that has worked a lot in terms of saying, this is how we can try to support families. So to say that families have been receptive or not What we would like to say, and this is what we have been doing in our work in raising awareness with villages, has been to discourage them from crossing the borders, because we know we are all one people actually. So from whether it's region 8 that have families across in Brazil, or region 9 that have families across in Brazil, or in region 7 that may have families across in Brazil or Venezuela, you know, and for region 1 as well. We have tried to encourage families to contain themselves to villages and not to expose ourselves. These things are still a challenge, and trying to get villages to totally respond to that. It is a challenge everywhere, but we have been working with communities to encourage them to contain themselves, to remain in the villages. Yes, Michael.
Thank you, Laura.
Just to add what Laura's saying as well, Mike, the conflicting laws regarding entry and access. So the indigenous communities and territories would have loved to be in total isolation during this time, but because of the laws regarding public roads and rivers passing through communities like Maruca, like the road that leads to Maruca Mountain Region 9, that has been very, very, you know, has not helped, I would say, in making sure communities themselves keeping themselves contained away from the virus. And so I think that generally it has been, like most of Guyana, persons having a happy-go-lucky attitude, business interests, having a great say what happens in communities, and wanting to reopen and have business go on as normal when it is not a normal situation. So all these things, you know, contribute in some ways to, especially in those hotspots like now Region 9, like Santa Rosa, Maruca, and other parts of the country where Aranca in particular as well, that you're having these surges in the cases. And so that is something that we've got to look at. And all of this, indigenous people's rights, the right to the territory, the right to protecting their waterways and so on, again, has come under the microscope.
Thank you, Graham. I think Ron would like to ask a little bit as well. Ron, would you?
Yeah, I just wanted to add a bit. In terms of the measures being put in place, I think communities have, well, some parts in Region 9 have been complying with them. However, because of the entry and access that Graham alluded to, and the mining area in Marudi, there have been a lot of conflict with miners and people trying to access village roads after the curfew, during the curfew hours. And gates have been broken. There have been more conflict with the village, the Tushaus and the leaders. The police recently visited the NTC chairman, who is the Tushau of Shulinap, to question him on people's right to pass through some of these lands, especially now that they're trying to protect or keep the virus from spreading in these areas. And this is a challenge, and has been, because up to last night, Shelton's gate was broken and they were trying to investigate. And I'm almost sure it is from someone from the mining community in Marudi who did this. There's also another aspect I would really like to caution the press on, because all the dailies reported on the death from Achueb, the woman who died from a snake bite. And it almost stated she died because of the gates being locked in Crowdar and Achueb. And this is not true. This is not true. The gates, there are systems in place for emergencies, and the woman got to the Aishalton District Hospital where she died. And again, this does not help it when people on social media are also saying, the villages are locking their gates and leaving people to die. And again, when you read the press, it kind of sounded like the gates were the cause for the woman's death. And I would just like to, again, just say, if you need proper information, please, Aishalton has a telephone, there's doctors, there are like the Tushaus, there are like different people that you could get first-hand information. So this is just something I wanted to add. Thank you.
Ron, if you can continue, and please put on your video the next time you speak. Samuel Suknandan for Demerara Waves is asking, said the Region 9 REO said a lack of manpower, difficult terrain pose challenge to Region 9's COVID-19 fight. What recommendations can the APA make to help manage this situation despite these challenges? And Ron, if you can answer that for us, please.
Yes, the terrain is really bad, and at times the rivers are very, very, very high. But again, I think the medical personnel is limited, and again, I know today RU alluded to the lack of funds or budgets being available. I'm not sure if there's emergency medical finance that can be made available for these doctors and these other personnel to actually go into these areas. I personally know that the people in the fields who are dealing with the COVID-19 patients and trace contacts are very, very tired already. Because again, sometimes you have to travel long distances to just do some of your work. You have to be in these villages, and it is not comfortable. And I think if we can get more medical personnel up there actually doing stuff, that can assist. But again, I am morely based in Georgetown, and I would not be the best one to recommend some of these things.
Yeah, but one of the things, Ron, that I have picked up along the way is that there is not enough resources available, like financial resources available in the regions, and even the Region 8 health authorities would have alluded to the fact that they don't have finances to carry out their work. And while I understand that we may be in a situation where it's difficult to access funds, some sort of provision should be made to ensure that funds are available for these persons to go out there and actually conduct the testing, conduct their follow-up, the tracing, contact tracing, and things like that. Because we understand and we know that in those regions, the terrain is difficult. The logistics is sometimes very difficult. If the weather is bad, the plane may not be able to go. And all of these things just compound the fact that many of our communities are isolated. But then we also know that COVID is threatening those communities, and we need to find ways in terms of ensuring that resources are made available to ensure that the workers, the medical personnel, get to those locations. And I think, Laura, you wanted to add something on the question as well. Please go ahead.
Yes, to add to what Ron pointed out there, a recommendation I would say come from the APA, because we've worked with different regions, and this I can only imagine that what the REO from Region 9 is saying would also be similar to what other REOs from other regions would be saying as well, because we've heard it numerous times. What I want to say is that, yes, we understand there is lack of manpower, the terrains and all of that. To cushion those challenges, one of the things that we've always recommended is to work with, for example, the district council bodies where they are, to work with the Tushaus, to coordinate with the Tushaus, and to involve them, to include the village councils and the Tushaus in these decision making. Because many times what we have experienced, or what the communities experience, that a decision is made at the central or the sub-regional level or at the regional level without proper consultation, without proper inclusion of the Tushaus, without the village leaders, without a proper inclusion of the health personnel within the villages. They're actually, most times it's just that they're expected to just do what is told to do without having to hear from the people on the ground themselves, who are experts on the terrain, who are experts on what manpower and resources they have in the villages. And so we need to really move beyond this thing, because it is not now we've heard of these challenges. And so we need to go beyond that and to say, this is how we work, this is how we involve Indigenous peoples. It is respecting the right to their free, prior, and informed consent. Inclusion is important at this time even more. So that's what I want to say. But also to add to that, I want to focus specifically on Chinese landing, because we have information coming in that the mining that they have been writing to the task force and to the Ministry of Indigenous Peoples Affairs since in the month of, I think it was April or May, April, I think. That mining never stopped. And it is ongoing, very mechanized, and it's happening in an area of dispute where the rights of Indigenous peoples of Chinese landing have been challenged at the highest court. But in the meantime, that mining is not supposed to be going on. So the task force out in Georgetown, so this is another thing that I'm bringing out here, is that the national task force in Georgetown really needs to be connected to the task force on the at the sub-regional and the regional levels so that there's proper coordination to see how we maximize manpower, how we maximize opportunities for use of resources, and to ensure that, and probably this is a response to what Navindra Suraj was asking earlier, what has been direct and indirect impacts? I would say a very direct impact, but which happens indirectly because of lack of response, is that a lot of decisions made have not been catered that in the event for Indigenous peoples. It can actually mean that the Indigenous peoples are protected as well, Indigenous peoples' rights. So at one point we make, the task force or Guyana made a decision that no mining will take place in Aranca, no mining will take place in, I can't remember which other area as well, but it did not address other areas where mining is taking place without the permission of communities, because Indigenous communities who may be engaged in mining have tried to say, and when we speak with them, have said that they've tried to contain their mining following best practices, just contain it to them, confine it to the villages themselves. But in the case of Chinese landing, that has been a huge challenge. And to get to Chinese landing, out of Chinese landing and past Chinese landing, everyone has to pass through, or most people have to pass through Maruca, through Santa Rosa. So do we understand the terrain? Do we understand the geography on best how we make, when we, on how best we make these decisions? Again, I go back to the importance of consulting and including district council bodies, tushos, in making decisions to ensure that we can maximize all opportunities, all resources to protect our people in the communities. That's what I want to say.
Thank you, Laura. Is there any other question before we wrap up? I see Autrey and Claudette Haynes would like to say something. Go ahead, Autrey.
Yes, thank the APA for this opportunity to be part of your meeting. I do agree with Laura with respect to inclusion and having the district councils and tushos involved in the whole process. Very early in the pandemic, I did ask Michael knew of this as well, if there was a Indigenous people representative on the task force. And I do learn subsequently that there now is. And I'm thinking that that individual should be in a position to help the task force understand some of the things that are being questioned right now with respect to terrain, logistics, right? Helping the task force to understand these things. So I'm still surprised that even at the regional level, you know, RUs are saying that, well, because of certain challenges that they cannot meet out adequately to provide a service that the region is supposed to provide to Indigenous communities. But Graham had said that he appreciates the effort that the APA is doing, and now the APA is the face of the task force in Indigenous communities. Did I hear that right, Graham?
Hi, Archie. No, what I said was that the regional authorities, Region 1,
Mhm.
very appreciative of the efforts of the APA being on the ground to provide support to them in public awareness and some PR.
Okay. Okay, great. Good. So I think, well, I think the whole of Guyana and indigenous people appreciate what APA does for indigenous communities. So I'm just wondering if the APA cannot form some formal link or relationship with the task force so that there can be greater representation of what happens at the community level for indigenous people, because I think there's really need for that type of understanding of what Laura is saying with respect to the rights, inclusion of indigenous people, to understand the logistics. And something I always wonder about as well is this fact that since this pandemic started, there was information in the media about resources coming from different international bodies, the World Bank, US, UK, the European Union. And in my opinion, what happens with those resources specific for COVID-19 and Guyana, there is not much information about how those resources are being used to impact or to resolve problems in Guyana and more so in the indigenous communities. So while I commend you for what you're doing, I am of the opinion that if we could probably reflecting on what we've done and what can we do differently or even better, is maybe to establish a more formal relationship with the task force, so that the trickle down effect through the district councils, as Laura is saying, and to the village councils can be better coordinated, and what happens is effective. Because I'm sure there are things, I'm not certain if some of the PPEs and other things you say that are given to communities, if any of those come from the task force, because I think there is an opportunity as well to use some of what the task force has, so that you can, as you distribute to the village councils and the communities, we get from the task force as well. So two other things. I traveled with a taxi not too long ago. I had on my mask, and the taxi driver so I asked the driver if he wears his mask at any time. He says no. So I asked why. He said COVID-19 is not real, and especially so in Guyana, because Guyana is a tropical country and the temperature is always high. So there are many, I think, people like that who feel that in spite of all the information that is shared about death, about infection rate, and so it's not registering to them that this thing is serious. So we have to be cognizant of people who will be in that mindset as well. So I would just like to say that. And I really appreciate what you're doing as a team. And if there's any way that I can support, I'm not certain how I can do so, but I'm willing to support you in any way. Thank you.
Thank you, Mr. Haynes, for sharing with us. At this time, I'm not sure if Jean would like to make a closing statement, and then we will close this thing for a day. Jean?
Oh, yeah. Thank you, Michael. Just a brief response to Audrey's comment there in relation to the task force. The APA did write a task force 3 or 4 page letter detailing our concerns and making recommendations. We did not receive a response. One of the recommendations a month before the outbreak took place in Santa Rosa was that the task force or the Ministry of Public Health should have a mobile testing unit or mobile testing facility in the village. That didn't happen until the cases started rising plenty. But like I said, we did not get back a response from the task force, and I'm glad for the information that there's now an Indigenous rep. When I first had a conversation surrounding the task force, I was told it's a ministerial task force, and therefore the name goes, it's a ministerial task force. But I don't know. For us, rather than wait on a task force or anybody else, we have the opportunity as an organization to do things. And we have experience as well in working with communities. And we use that experience and we transfer it to whatever area we feel we could, of course, with advice and with support from those communities. And therefore, sitting and waiting on the task force would not have been the best for us. We may not have gotten out to the communities and so forth as yet. So I just wanted to add that we did make an approach and we did write and we did not get back any response as well. Yes, I want to stress the need for awareness in the communities. You have people who are still doubting that COVID exists, that it is has implications, health implications, as we have been hearing all along. And then we have the whole political scenario where that has been infiltrated the whole COVID issue and make people disbelievers or people just not want to feel that it should be dealt with. And therefore, I think awareness is one of the key that should take place in the Indigenous communities. We have, like I said, put out a number of posters, but there are other communities that can use those very posters. We need a whole range of the loud hailers in the communities because we are aware that you can't have face-to-face meetings and that sort of thing. So these are some of the ways in which we thought we could do that, but as much information to the communities in a simpler language as possible or in the language of the communities as much as possible should go to the communities as well. There's need for testing. Michael touched on it for Region 8. Ron touched on it for Region 9. And in the early days of Region 1 in the Molucca sub-region, testing was only done on a very small scale. And we feel that there should be, the number of testing should increase greatly in those communities, especially those that have been affected. And that attention must be paid to information coming out from those communities. Attention must be paid to people who know those communities, people who are aware of that Itabak and Canapang lies on the border with Brazil and know that there's interaction between those communities and so forth. Rely on the human resources that have the experience and the knowledge. This is what the task force can do. There's need for support of the health authorities. Again, I heard all of our reps say this, but I can't overstress the need. Need in terms of the PPEs, need in terms of sanitization, need in terms of beds, need in terms of quarantine facilities, needs in terms of increased human resources. Santa Rosa started out with very low number of doctors and other medical personnel in the community. Now the number has increased, but prior to that it was very small, and therefore you had one doctor, two doctors who would cover those 11 areas that comprises the Santa Rosa village. And it's a huge area, and who would try to move and still have to look after patients coming in the normal course of the day for other illnesses and so forth. So it's a huge stress on the human resources of the medical personnel. Graham pointed that out, to do awareness and still look after the patients. And with that in mind, I'd really like to commend the medical personnel, the doctors, the nurses, the cleaners, the drivers, all the testers, and whoever, all who participated, who worked in the Santa Rosa and outlying communities affected by COVID, and who were able to reduce the numbers. They work with the district council, work with the village council, to show Anita Phillips of Santa Rosa, all the efforts that people put in there, the business people who supported, and all the others who supported as well. I just really like to point out that, with all the support there, and it could have been a lot better. It could have been a lot better, but with the support there, we were able to get where we are. My hope is that we don't have, if there is a reducing of the curfew or whatever measures are taken, and it happens too early, that we see another spike in cases as well. And I think that should be taken very seriously in the case of Santa Rosa. I think all communities need mental health support. Many of the communities in Santa Rosa, I know, or many of the families in Santa Rosa that I know who were in isolation or who are in quarantine, husbands, wives, children, teachers, all have some story to tell about being traumatized, mentally traumatized. And I think that aspect of COVID is not being looked at when it comes to the communities. God knows down the line, 6 months from now, a year from now, what will happen to the people who have had to endure isolation and so forth in those situations. So those are some of the things. Support to the health council, support. Laura pointed out the village and district authorities. That is very important as well, and just support all the way around. Communities are need basic food supplies. You know, we are in a current political situation that doesn't put a focus on the situations that are taking place in the various communities, but people are suffering and people need support as well. So I just want to point out that these are some of the areas that we really need to see support, that they must be focused on Indigenous communities. And we thank those who have stepped up. We thank the funders who have stepped up. We thank the local persons who have stepped us, and we know will continue to step up as well. Thanks, Michael.
Thank you, Jean. And thank you for all who have participated, would have joined and asked questions. You can reach us at our office. We have resumed operations at the office. So there is someone at the office every day. However, we're working on a rotation basis. You can reach out to us through our email, apagui@networksgy.com, or you can contact our Visibility and Communication Officer, Ms. Mariah Lal, at mariah.lal@apaguyana.com. If there are any questions, you can always call our office, or you can get onto us through our page as well. But thank you for participating in this update on the COVID response from the APA across Guyana. Have a good afternoon. Thank you.